Hello, and thank you for meeting with me today. My name is Taylor Boone. I am a certified occupational therapy assistant and currently a student of a Master's of Occupational Therapy program. I'm a member of the American Occupational Therapy Association, and I currently work in a skilled nursing facility, which there are 429 facilities in the state of North Carolina that your constituents live in. Working in a skilled nursing facility, a lot of the patients that we treat are either Medicare Part A or Medicare Part B. We provide the people in those facilities with tools to participate in daily living tasks like bathing and dressing and using the restroom, in addition to community engagement within the facility. This could mean participating in a daily group with peers or accessing the dining room for group meals. Additionally, outside of skilled nursing facilities in general, as occupational therapy providers, we help people of all generations participate in daily occupations. That can be an assortment of meaningful tasks, including things that I mentioned before, in addition to leisure tasks like gardening or going to a sporting event. We assess the barrier that illnesses, injury, or disease create in the participation of those tasks, and we work to rehabilitate, adapt, and compensate for those. Within the healthcare industry, OT or occupational therapy helps to provide other healthcare professionals with a unique, holistic point of view for treatment and promotes client-centered and collaborative treatment models. Within the geriatric population, working in those skilled nursing facilities or assisted living facilities, OT works on social engagement, often lost as we age due to factors such as disease, depression, or environmental changes. We also work towards restoring the function needed to complete self-care skills through the adaptation, restoration, or compensation approach. So what I'm here to talk to you about today is the patient-driven payment model, or PDPM. It's the new Medicare payment rule for skilled nursing facilities. It replaced the RUG IV system or RUG 4 system with a completely new way of calculating reimbursement. Under PDPM, therapy minutes are removed as the basis for payment in favor of resident classifications and anticipated resource needs during a patient's stay. PDPM assigns every resident a case mix classification that drives the daily reimbursement rate for that individual. While the model isn't necessarily the issue that we as occupational therapy providers are concerned about, we're more concerned with companies that are employing therapists and providing care are mandating group or concurrent therapy of individual service over individual services, regardless of the need of those types of intervention. This can reduce or limit therapy minutes per the patient, and it also creates a sweeping decision to lay off therapy staff, reduce hours, cut pay, which all limit the ability to provide skilled services for the patients, your constituents, within those nursing facilities. Without proper rehabilitation and access to OT services, functional outcomes run the risk of decreasing, creating increased level of care changes, and the need for more long-term care stays and hospitalizations of those beneficiaries. Many companies have reported 35% layoffs or reduction in pay, as well as reclassification of therapists from full-time to either part-time or as needed. Patients are receiving less therapy, and work requirements are for 6 hours a day with increased administrative duties. Quality individualized therapy is vital for patients to be able to return home with proper tools, including education, compensation, and rehabilitation techniques. What we're asking from you is to protect the access to these necessary therapy services in the skilled nursing facilities. We ask that you tell the Centers for Medicare and Medicaid Services that they need to assure access to skilled therapy services under this new PDPM system. Revision to include the beneficiaries receive the therapy they need and deserve. As everyone is individual, so is process during recovery. Reimbursement shouldn't be based on someone's ability to recover more quickly than someone with more secondary concomitant issues. I want to thank you for your time and listening to my concerns about the payment-driven model, and I would love to know what method or time frame would be best to follow up regarding this issue. And I'm looking forward to hearing back from you so that we can further discuss this concern of mine and many other therapists within your area and how it affects your constituents. Thank you.